Welcome back to the Global Business Report here on Arise News. Primary healthcare is the foundation of healthcare delivery, with a focus, of course, on health promotion, disease prevention, and curative care that's accessible and affordable to all. So Nigeria's system does need improvement to cater to its growing population. Now, primary healthcare system in Nigeria is facing hurdles as it tries to meet the needs of its citizens. The Tinubu administration is aiming to improve that. The coordinating minister of Health and Social Welfare, Dr. Mohammed Ali Pate, said the ministerial Oversight Committee in a meeting on March 28th has approved the release of 25 billion naira to the National Primary Healthcare Development Agency and the National Health Insurance Authority from the Basic Healthcare Provision Fund. Joining us to discuss further from our Abuja studio is Dr. Muyi Aina. He's Executive Director of the National Primary Healthcare Development Agency. Doctor, thank you so much for joining us, and good morning to you. So can you tell us a bit more about the footprint of the NPHCDA across the nation as it supports the delivery of primary health care?
So the National Primary Healthcare Development Agency is under the Federal Ministry of Health that is charged with the development in Nigeria. What that means is that we work.
Dr. Aina, apologies for the connection issue there. So just to recap, can you again tell us about the footprint? I think you were saying that you are partnering with healthcare delivery entities, so you're not the ones providing the healthcare. There's a partnership. So go ahead, please.
So can you hear me now?
Clearly, loud and clear, sir.
Excellent. So what I was saying is the National Primary Healthcare Development Agency is that agency of the federal government of Nigeria that is charged with the development of primary healthcare services in Nigeria. We do not directly operate health facilities. The states are responsible for that, but we support the states through resource mobilization and coordination. We provide technical assistance, guidance, we set standards, we coordinate partnerships, we generate knowledge, and just support the states to try to do a better job of what they're doing. That's really our role. So to that regard, across the country, the services that we support really are delivered through primary health centers. The vast majority of those are public, but there are a few that are, partnerships between private and the public. But there are up to 30,000 of them across the country, but the government directly funds at the national level through the Basic Healthcare Provision Fund, 8,306 primary health centers across the 36 states and the Federal Capital Territory. They get something called DFF, the Direct Facility Financing, which is money that goes to them quarterly, each of these health facilities, to provide the operational expenses that it needs. Money to put on the lights, money to make the water work, money to buy the basic commodities that they need, money to recruit ad hoc staff that they need to keep the facility functional. So 8,306 currently receive this, and the minister has committed with the president that over the next 2 to 3 years, we will be expanding this number to 17,600. Now, just to say that the expansion, while the first wave of 8,000 really follows the one per ward, which is what the federal government has committed to in a long time and we're striving to deliver on. We're going to spend a lot of time and resources and effort, we already started that, to increase the functionality, meaning they are safe, they have the infrastructure, they have the human resources, they have the commodities, they are accessible so that every Nigerian, wherever they are, can in fact walk into a primary health center near them and get access to basic services that they need. Of course, we're doing this in collaboration with our sister agency, the National Health Insurance Authority, who has a mandate for financial protection. So it's one thing, we work on service readiness of the primary health centers, but by providing health insurance to vulnerable people, the National Health Insurance Authority provides financial protection so that when you go to attend antenatal care, when you go to have a baby in the primary health center, when you go to get immunized, or when you get to diagnose when you take your child to diagnose or treat malaria or other illnesses, you don't have to pay out of pocket, which is a problem for many Nigerians. Thank you.
Thank you for that. So I guess we're looking at the website of the agency, and there's a transformation agenda there, I think up until 2030. And one of the list of things that they're trying to achieve on that agenda is boosting finance, right? So I wanted to ask you, beyond this initial 25 billion that has been set out between you and your sister agency, how do you intend to, I guess, get more funding to be able to assist the out-of-pocket costs for, I guess, the vulnerable and so on and so forth that are scattered across the agencies you work with? How are you going to get more funding in there?
Good question. So thank you very much. There are a number, like I told you, one of the mandates of the National Primary Healthcare Development Agency is, in fact, resource mobilization and coordination for primary healthcare development. So the Basic Healthcare Provision Fund is a government intervention that is in perpetuity. So it secures money that goes through multiple gateways, 4 gateways, but the NPHCDA and the NHIA, Health Insurance Authority, are the bigger ones, to the states through their respective agencies to provide services in the front line. But beyond that, there are multiple other sources that we try to coordinate with. The states themselves, who are the primary owners of the PHC services. Many states have expressed their plans for us to invest in primary healthcare services. Many of them are investing in building or upgrading facilities. Of course, states already hire health workers. States already provide commodities. So what we're trying to do is also coordinate this to make sure they are aligned towards a set of priorities and targets that are aimed at addressing the top causes of maternal mortality, the top causes of infant and child mortality in Nigeria, and really aimed at reducing deaths, but also reducing pain from illness among Nigerians. In addition to that, in our budget for 2024, we have been lucky that the president and the minister have made available resources that will go into facility upgrades. So basically, looking at some of the basic healthcare provision supported facilities that don't meet the standards that they should meet in terms of basic infrastructure. The walls are dilapidated, the roof is not working, or it's not accessible. We're going to be addressing some of those in a strategic way, in a data-driven way. So towards that, what we have in fact done is to commence a national baseline assessment to look at all of these 8,000 facilities. We've already completed 24 states just before the holidays, but we, after the Yuletide season, we would complete the rest of the 13 states, just so that we have the information and we can move intelligently. In addition to this, there are quite a number of National Assembly members who have constituency projects that are really targeted at investing in PHC. This has always been the case, and it's the same for 2024. What we're doing different this time is to say, look, how can we coordinate this? We set the standards, we guide them and partner with them so that even within their constituencies and the mandates of the resources that they have, they are moving based on evidence, based on data, based on need, rather than without guidance from us. And there's a lot of reception to that. That's both at the Senate and at the House of Assembly. So we're continuing that engagement. The private sector also has a substantial amount of investment that they either already make or want to make in the primary health center. I know that through the Private Sector Health Alliance, we began conversations around really mobilizing the resources within the private sector to adopt PHCs across the country. So these are some of the types of places where we're mobilizing resources. There are development partners as well that are giving us substantial resources. Many of them target specific things. Some of them want to provide solar power to facilities, for example. So we're guiding and managing that to make sure that it's going to the places where the need is most. Some of them want to enhance our ability to provide specific services in a way. So we're organizing to integrate that within the primary healthcare center services broadly, but using the resources in a way that it again improves the quality of our health facilities. So there are quite a number of different sources that resources will come from or are coming from, and we are coordinating that and just making sure that all of that is synced in a way that we're getting maximum value from them and we can deliver to Nigerians functional, high-quality primary health centers.
All right, in order to deliver functional, high-quality health centers, you need staff. There's issues, of course, with the number of doctors we have, or healthcare, healthcare professionals to provide these services to those that need it. We've been covering what's been going on in Korea. There's been, I think this is going on almost a month and a half now, where doctors in Korea are on strike. They're back and forth with the government there. Also in Kenya, we covered this yesterday, there's an ongoing strike there as well over salaries and so on. And we have our own issues here in Nigeria as well. What's your view on how to solve these, whether it's payment issues or whatever it is between doctors and the government, the exodus of medical professionals overseas, and then the low patients to medical professional to patient ratio that we have in Nigeria? How do you think we can solve this?
So I think you're right. Globally at this time, I think health worker shortages are quite pervasive, and what that has resulted in a lot of migration. So not just in Nigeria, but everywhere else. There's a lot of mobility, there's a lot of unrest and issues that governments and health providers, even in the private sector, are contending with when it comes to health workers. I think one of the priorities of the coordinating minister for health and social welfare, Professor Mohammed Ali Pate, is in fact to tackle the human resources for health challenge for Nigeria head on. And he's really developing an end-to-end program of strategy to really address this. Everything from that will address the production. How many do we need? How can we expand production of health workers? So I'm sure you've heard in the news, expansion of capacity in medical schools, in nursing schools, and all of that. There are things around how do you retain and motivate them, create an enabling environment. I think pay is one of it. You're going to have to continue to work within the framework of what the government can pay, at least for the public sector. But there are many other factors that make pay that affect job satisfaction among health workers. The environments, the facilities, the investments, operational functionality of their health centers at all the different levels. But also, how do you build a robust task shifting program so that if you contextualize it, the states are very different. So a place like Lagos, a place like Port Harcourt or Abuja, it has a lot of doctors because they're conducive and people are happy to live here. But when you move to the rural areas, when you go to my village in Kogi, for example, it's a bit harder to retain doctors there. So sometimes you then have to figure out a way to task shift in a way that you can use midwives, nurses, even community health workers to provide services, but in ways that are well supervised and standardized. Of course, there are also interventions around the use of the diaspora. One of the positive outcomes of the substantial migration of health workers from Nigeria is that we have a very large health workforce, diaspora health workforce body, and many of them are looking to participate and give back. So really trying to also provide a platform for them to engage is one of the things that the Federal Ministry of Health is doing. Specifically to the primary health system though, a lot of our services are actually at the basic level. So how do you provide maternal and child care services, basic services? How do you provide immunization services, prevention, health promotion, and all of that? So we hinge our work a lot more. We have doctors in many places, but in many places we hinge it around the nurses, the midwives, the community health workers. And the challenges are similar, but there are specific interventions. We have about over 2,000 midwives that the NPHCDA currently employs that have been deployed across the states to supplement what the states are doing in facilities where, there is a shortage. We're doing that. And we're working with a couple of partners now actually, to mobilize resources to expand that number substantially, including creating incentives that will help us to retain these health workers in some of the rural areas. One thing is to have the health workers, the other thing is for them to have the competence that they need. So yesterday, in fact, we started the process. Again, something that the minister has promised is the retraining of 120,000 frontline health workers, meaning the doctors, the nurses, the midwives, the community health workers who are currently working in our primary health centers. So we started the national training of trainers yesterday. That will be cascaded to the states next week. And then later in the month, we will get to where we're actually training the actual health workers across the states in Nigeria. Of course, we're doing all of this in partnership with the oversight bodies, the Medical and Dental Council of Nigeria, the Nursing and Midwifery Council, but also the oversight certification bodies for the community health workers. So these are some of the things we are doing. I don't think there's one magic answer to it all. I think it's because the problem is quite multifaceted and complicated. I think it's really about pulling a number of multiple levers, to say how can we increase the number that we have? How can we increase retention among the people that are working? How can we get more value from where we have shortages? So for example, can you use telemedicine and technology to have higher trained people supervise lower trained people and expand the footprint of services that they can provide. So we are working aggressively on this, and I think Nigerians are already beginning to see some of that. Thank you.
All right, Dr. Aina, we appreciate you breaking it all down for us, and it's very, very important, of course, that competency is in the medical sector. So good to hear the update on the training that will be taking place. We thank you so much for your time, Dr. Aina, who, of course, is the Executive Director and the CEO of the Nigeria Primary Healthcare Development Agency.